going to be going from the red phase to the yellow phase. Before I talk about that, though, I just wanted to summarize in the last week, we've continued to see a low level of positive cases coming up, low level percentage, still under 10% of the testing is revealing positive cases. So again, for the 8th, 9th week since we've been under this order, we have seen this region continue to listen to the expert advice that we've been giving from our medical experts and keeping our numbers low, social distancing, all the mitigation strategies that we've been recommended by our professionals. Moving into yellow, that will change a little bit, and we're going to have more potential for people to come in contact with each other as offices open up, retail opens up, and childcare opens up. And we also know that in dense office areas like downtown Pittsburgh, the Strip District, North Shore, South Station Square, South Side, Oakland, etc., where many offices are operated, we're going to ask folks to continue to be very diligent and very responsible as they have been over these last number of weeks. The governor's order still asks for people to stay at home and work from home, work remotely if they can. But we also know that as people do come into the office to work together, we are hopeful that people will stagger their shifts, and the business community has been very, very cooperative in doing that. But the same strategies still need to employ. We still need to keep the physical distancing of at least 6 feet. We still need to be wearing our masks when we're in with other folks. If you are sick, we ask you to stay at home so that you do not go into the office and do not go to the retail stores, etc. We know with elevators and again, compact buildings with a lot of workers in a small area of space, we need people to obviously be very vigilant again and courteous and be mindful of all the folks that are on there. So we've really reached this point because we've been able to have folks be responsible in their actions, both at home, at the workplace, when they haven't been able to work in all the settings they've been doing. There are other parts of the state and other parts of the country that aren't going to see their economic opportunities open up to the level that we are. So we're glad because we know the pain that so many people have felt who've been out of work and have been able, and businesses that haven't been able to make the revenues and make the money that they have been in the past. So for all of us to have this opportunity to open up our economic, just the economy that we want to have, that we had before this happened, we want to have people continue to be responsible so that our health levels don't spike on us, the positive numbers don't spike on us, and we're able to get people to work in a safe manner. Again, with the masks, I heard Governor Cuomo mention this. Let's show the respect of our first responders, our nurses, the folks that are out there working. It's really for all the other folks that the masks are worn to protect everybody else in their daily life. So with that, I want to turn it over to Dr. Bogan to update us on where we are as we move into the yellow phase in the next couple of days. Dr. Bogan?
Thank you, County. Thank you, County Executive. I know businesses and organizations across Allegheny County that are permitted to reopen and restart in-person operations under the yellow phase are hard at work on plans, procedures, and modifications to their stores, offices, and work sites in order to keep everyone safe. The health department is hard at work too. We are putting a plan in place to have enough case investigators and contact tracers ready to respond to any amount of new cases, and we are continuing to encourage more testing for Allegheny County so that anyone who starts to feel sick can get a test quickly and easily. We hope we don't see an increase in cases when we gradually start to reopen, but there are actions we can all take to continue to keep each other safe. It's important that everyone follows the guidance from the governor and health officials for reopening Friday and going forward. These instructions are in place to protect all of us. Continue teleworking or working from home if you have been. Just because we can return to offices, shops, and work sites doesn't mean we should. Staying home and physically distancing is still an effective way to limit the spread. If you're sick, stay home. Call your primary care provider or the health department's COVID hotline at 888-856-2774 for information about testing. We have more information about testing, including a map showing current locations on the health department's COVID-19 website. Even though we're moving into the yellow phase, we should still limit trips out of the house to essentials like food and medicine. Remember to wash your hands with soap and water for at least 20 seconds, or use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not your hands. Clean surfaces frequently, and if you must go out, keep at least 6 feet from others and wear a mask when you're around other people. I have received many questions about masks, when and where to wear them. Like physical distancing, staying home, and cleaning surfaces frequently, masks are another tool to protect yourself and the people around you from COVID-19. Masks help stop droplets that contain the coronavirus from spreading and infecting others. Remember, my mask protects you, your mask protects me. Hopefully by now, homemade masks such as this one I have with me have become common sight, and I'm going to show you how to properly put on and take off the mask. Only handle masks by the strings or loops. Secure it to make sure that it covers your mouth and your nose. Droplets can come from either. Wash your hands or use hand sanitizer before and after putting on your mask. Touch only the strings or loops and taking it off, and store mask in a safe place like a paper bag if you plan to wear it again soon, and wash your mask after extended use. Okay. Wearing a mask is important because we know from studies that about half of people who have COVID-19 don't know they have the virus. They are asymptomatic. Masks must be worn when entering a business or shopping, visiting a healthcare provider, or taking public transportation. Employees who interact with the public must wear masks. Masks do not need to be worn when driving alone, inside a personal vehicle, or with members of your household. However, masks should be worn if going through a drive-through or utilizing other services while inside your vehicle. Employers know their individual businesses best. They are expected to follow the state guidance for operating safely, and each is working individually to develop plans to open up safely. Leaders around the county have asked the business community to follow guidelines closely and take them seriously. Masks do not need to be worn while you are outside walking, running, riding your bike, hiking, or enjoying other activities, as long as you are by yourself or with other members of your household. But please leave space between others. Consider safely crossing the street to avoid people, or finding a safe spot to step off the trail and let others pass. You should carry a mask with you so you can put it on if you do come across a crowd or can't stay safely apart. I'm sure there are many, many more questions concerning specific situations and scenarios about when to wear a mask, but if you're in doubt, use caution and wear it. We're asking people to do what's best for everyone's health and safety. We don't want to have to devote energy to enforcing mask wearing. We hope everyone follows the directions, and let's respect other people's fears and concerns and wear our masks in public. It's a small thing. It doesn't take long to put it on, but it can have a big impact, and it can save lives.
Our first question is from KDKA Television. Is the county health department concerned about seeing a spike in cases as we move to the yellow phase?
Want to take that?
Well, I think we both probably answered this, but certainly we're nervous. I think we've heard so much about, from the business community and from people that haven't been able to work, and obviously been frustrated over the last couple of months as their businesses and their work lives have been affected. And as we've succeeded in keeping those numbers low, much lower than the 50 per 100,000 over a 14-day period that the State Board of Health has put out there. And at this point, as we move into the yellow, as Dr. Bogan said, and so many of others have said, we've got to be responsible. We've got to make sure that we continue to practice all the mitigating strategies that have gotten us to this point, that has put us in a position to be able to have so many of our folks go back to work and make a living. And that level of stress is also makes you apprehensive as well. I was every bit as apprehensive when we asked for the things to shut down, because we knew that would have impacts also and on people's health as well as their economic health. So it's something we shouldn't just rest on our laurels. We shouldn't just assume everything's going to be okay, because this is a long game that we're going to have to continue to be responsible for ourselves, for each other, and for the community. Dr. Bogan, did you want to?
No, I think that covers it. But let's see if I take the next one.
This is a question from the Post-Gazette. When the county moves to yellow, what public facilities will see changes in their operations? I'm thinking specifically of places like public parks, pools, fields, etc.
Well, one of the things we've done even during the red phase is we kept our county parks open. And I know other municipalities, including the city, kept a lot of their parks open. Programming certainly and sporting competitions did not occur, and they won't occur even in the yellow phase. What was the other part of that, Amy, if you just...
Sorry.
Parks and there were other...
Public parks, pools, and fields.
Pools, yeah. No decision has been made on the pools as of yet, but my sense is that at this point I'd be pessimistic to think that the public pools would be opening up this summer. And in public spaces, certainly, we encourage people to use the public spaces in a very responsible way, whether it's a trail, a field. Keep the keep the physical distancing, and do the things that we want to do. But we want folks to do on a responsible manner.
This question is from WESA. A lot of listeners and readers are feeling uncomfortable with Allegheny County moving to the yellow phase and are asking for specific justification for why it is time. What information can you provide to help calm people's concerns?
Well, much like the first question, the levels are much lower than the 50 per 100,000 per 14 days. We've been way below that, and we've been way below that for a number of weeks now. And the other end of the health spectrum is, people being kept at home also has a health effect on folks as well. So there is that balance, and there's also the economic livelihood that so many people have been suffering throughout this. So we're going to learn a lot over the next couple of weeks as to where these levels go. If our levels spike up to a higher level, there may have to be some things that would be shut down again, and that would be very unfortunate, because that's not what we want to do. We would hope that over the next couple of weeks as we open up, that if we continue to keep our levels low, our positive testing low, that other opportunities could possibly open up, things like restaurants, hair salons, and other things that also have not been allowed to operate for the last couple of months. So this is a very fluid and ongoing situation, and we'll just have to see where these numbers go. There's a lot of uncertainty. There's a lot of nervous people over economics, over health. We can appreciate that. I certainly can appreciate that. And we're going to continue to monitor things, as Dr. Bogan said, with testing, with contact tracing, with so many people, with so many strategies and planning to open up a little bit. That we're gonna try to be responsible.
The next question is from WTAE. The Breathe Project has been calling on the health department to take action to improve air quality during the coronavirus pandemic, after a new analysis by the Clean Air Task Force showed no significant change in pollution levels in the area. Does the health department have a response to this request?
Well, we have continued our enforcement as always, and we have seen improvements in our air quality And that was discussed today on our Board of Health meeting, which was recorded.
This question is from the Tribune Review. Could you comment on why the general public should be concerned about outbreaks at nursing homes and long-term care facilities? How can outbreaks at those facilities impact the general public, even those people with no personal connection to a facility?
Well, long-term care facilities have workers in them who go home every evening. And so those are people who are in our community every day, and they are members of our community, so we should all care about them. They're our grandfathers, our mothers, our aunts. So for me, the long-term care facility is a huge and important part of our population, and so we need to be paying close attention to them.
This question is also from WTAE. Dr. Shapiro testified before the State Senate Committee today regarding the reopening of Allegheny County, and said that he agrees with experts who say we will see a spike in cases, but also said that there isn't a safer time to emerge. From a governmental perspective, why do you think Allegheny County is prepared to start reopening, and what would you say to people who are afraid of a spike in cases?
Yeah, and I think as the doctor said in his testimony, there's probably no better time, just because, again, for week after week after week, the number of positive cases has remained low. It's been much lower than the metric that was put out there. There's also a very robust ecosystem of eds and meds here in Allegheny County and throughout southwestern Pennsylvania. We're very fortunate of that, to have experts like Dr. Bogan and a lot of the folks that she talks to and convenes with on a daily basis, from University of Pittsburgh Medical School, UPMC, AHN, St. Clair, Heritage Valley, Washington, Excella, Butler. They've all been, and we have these experts who have been very, very helpful throughout this process. I don't know that I would, hopefully we don't see the level spike. I mean, I don't know how you define that, but we know that there's the potential as people go out more to have more spread. And the question will become as to how much that's going to occur. So we'll see what happens in the coming weeks. If we continue to see our levels low and hopefully our economy open up again and get people back to work, that we're able to balance it.
This is a question from WESA, and the reporter acknowledges that they have asked a similar question previously, but just wanted some clarification. Do you have the capacity to investigate and perform contact tracing for every case? And if we see a spike, will we still have that capacity? How will we measure the county's capacity for contact tracing?
So we have, throughout this entire pandemic, been doing consistent contact tracing, and we have been able to reach most of the people we try to, which has been fantastic. And we have designed a flexible and responsive plan to sort of increase the numbers of contact tracers as the cases increase. So we have a plan in place that is responsive, and we can revisit over time, right? So one of the nice things is your trends can show you what might be coming in the future. So if we're seeing an increase and we need more contact tracers, we'll be prepared to increase the number. And that will include, we're putting in place a very careful training process for our contact tracers that will be used as new ones need to come on. But we have a very flexible and responsive plan right now, and foresee not a problem of meeting those numbers.
We have similar questions from a number of outlets related to whether the county has information regarding what the triggers are to move either back to red or up to green, if there's specific numbers or status marks that we need to hit in order to get to those.
I have not seen specific guidance. I don't know if...
I think this is a very fluid and flexible situation. I'm not sure a lot of the definitions have been put in place to where green would go. I'm assuming if our numbers do spike up and remain there for a certain period of time, that the possibility and potential to go back into the red would be there. I'm assuming it's the same metrics that we had coming out of red to yellow, that 50 per 100,000 over a 14-day period. But a lot of that hasn't been defined. I'm sure there'll be other definitions along the line of capacity of ICU, ventilators, et cetera. So I think that'll go along. But let me just also reiterate, if I tried to say this again yesterday, but even when we were in red, things started to open up a little bit. We saw manufacturing, we saw construction, we saw golf courses, we saw real estate, online car sales. Things started to open up even within the red definition. My sense is that even the same thing would occur within the yellow definition, that there could be things that aren't opened up right now that could be if things remain stable and in a good place. So I don't know that there is a black and white, definition of what that would be, but I do think that the State Department of Health, in consultation with a lot of local officials, will make that determination as things move along. So as things like testing, contact tracing, all the things that we've been talking about occur, I think those could happen. For example, restaurants. We know you can go to takeout and get restaurants at takeout. Will we have outdoor seating in restaurants? That's probably a potential that would open up fairly soon, because right now you could get takeout and go sit at a park bench or go sit somewhere on steps somewhere and still be outside. Well, if a restaurant has enough space and they could keep their tables far enough and seating far enough, maybe you could have some outdoor seating as a possibility. These are just, again, some of the things that could possibly occur, because, again, we saw this in the red phase and we could see some of this occur in the yellow phase.
The next questions are from the Post-Gazette and are related, so I'm going to ask them together. If you need me to repeat any of these, I'm happy to do that. There were 19 more deaths in nursing homes reported today. And although the question doesn't say that, I presume that's the information from the state website. Do you know if the now 109 nursing home deaths are largely concentrated in just a few nursing homes beyond King, Glen Hazel, or are they spread among the 35 nursing homes in the county that have had at least one positive test?
So the nursing home data is really not mine to share. It really is the state's data to share. And so I don't have that ability to share that information.
The follow-up question to that is whether any of the nursing homes in the county outside of the Kings have requested assistance from the county or the state because the outbreaks in those homes are so large and it's straining their staff or their ability to handle the outbreak.
Was that a question about the Canes specifically or about all of them?
It was about whether anyone other than the Canes have asked for help from the health department.
So we have spoken to lots of long-term care facilities and given them guidance and support, and I believe that some of them have spoken to the state, has also provided resources, many resources to the long-term care facilities. I can't tell you which ones have received those services, but those services are available, and I understand that there are facilities that are using them.
This question is from Kitty K Television. Will the county enforce businesses that don't follow guidelines in the yellow phase? And if so, what will those guidelines be? I believe they meant the enforcement.
Yeah, this question came up yesterday, and I think both the mayor and I talked about this, that, the enforcement is not going to be a police action in which you're going to have people, going into businesses door to door looking at what they do. This is really something that the community and social pressure and cooperation is going to have happen. If people are acting irresponsibly, not wearing their masks, not keeping distance, showing up and coughing and in places that they shouldn't be doing these things, I think there will be certainly it could be reporting that could be done to the state, and I think there's a website to do that. But more importantly, it's going to be up to all of us to act responsibly. I use the example smoking. Smoking is illegal in elevators and in offices in a lot of places. But I don't think we've sent an enforcement action to send somebody to jail or send somebody a citation if they smoke in the elevator. We see that other people will act with social pressure and to make this occur. So all of us are responsible for each other. I'm not saying that there wouldn't be some enforcement action if there's some very, very egregious things that would occur or companies are doing some really bad things. But I think there's also other checks and balances within how this will happen. I think, first of all, if a business is irresponsible, their employees may not want to work there. or customers may not want to come into their facility if they're not acting responsibly. So in many ways, the market and the social pressure will do that. But you know, as time goes on, we'll see how this occurs, and I guess if action needs to be taken, it's something that could be evaluated in the future.
This question is from the Tribune Review. Are there any specific initiatives you can tell us about that the county is involved in to improve data on race or to expand testing in communities of color and low-income parts of the county?
Yes, we're always trying to improve the data we get through the system. The NED system where we get our data is a very old system and requires some changes, and it makes it sometimes hard to get the data we want. I did discuss again this at the Board of Health meeting today. In terms of increasing testing, we are working very closely with our federally qualified health centers to get testing available in those. And we hope to have an announcement about that in the next couple of days. But that certainly would expand testing to many of our neighborhoods, and that is our goal. And I think over time there will be, as technology changes and the testing types that we have available become available, this pandemic, if you look week by week, the technology has changed every week. The capacity to test has changed by weeks. Our availability of supplies has changed week by week. We are continuing to look at new technologies and new capacity to test. And as soon as we find those, we'll put them in the right places and help people to do that. So yes, we're constantly looking for ways to expand testing. But again, that changes constantly.
There are multiple outlets asking questions about testing, so I'm just going to read the questions for you, and I'll pause to let you answer them. The first question is whether you believe that the metric of 2% of the population being tested each month is a good one.
I think the most important thing is that we test everybody who has symptoms. And again, the criteria for testing continue to change. For a long time, we were saying that the testing wasn't very good at picking up people who were without symptoms. Well, the testing has gotten better, and we're now able to pick up people without symptoms, and that's been demonstrated lots of ways. So as the technology changes, our guidance on who gets tested and why we get tested has changed and will continue to do so. So I'm not, what I want to say is we need to be able to test people who are symptomatic, potentially people who are close contacts of those who are symptomatic, and over time that may change, and those recommendations may change to test more asymptomatic people, but that's not the current guidance.
The next question is that Dr. Bogan has made the point several times that neither the county nor the health department are really in charge of testing and encourage and support efforts for others to do it. But if the county isn't in charge, who is in charge of testing or coordinating those efforts to make sure it's happening at sufficient levels, particularly with the state asking for certain metrics to be met?
So testing that occurs at healthcare institutions, those institutions are responsible. So for instance, most of the hospitals, I believe now, are doing pre-procedure testing. They're responsible for that. We do look at the where there are holes and try to find opportunities to fill those. Again, that's part of the work we're doing with the FQHCs. I've certainly spoken to other kinds of healthcare providers in the community and are working to expand and find access for those. But again, that will depend a little bit on the technology that's out there. So again, we don't perform the testing. I see us as a facilitator to encourage and support people that do and find opportunities to help them do that.
This question is from the Tribune Review. There were new testing requirements released earlier this week regarding long-term care facilities, a suggestion that 1 time per week for all staff and residents. Is that feasible? Will this put a strain on our resources?
So the guidance is recent and has come out, and we're being responsive to new guidances as they come out and are working to support the long-term care facilities to implement those guidances. The state has a long document about what they're providing, so I'll leave it to the state to provide the details. But we just really support and encourage what the state guidance has come out and said.
And this final question from KDA Television. Is the county prepared if we see a second wave of COVID-19, and what might that look like?
So we prepared. So we are tracking data at the health department very closely. We look at emergency department visits, we look at hospitalizations, we look at bed availability, we look at our cases, we look for clustering in those cases, and that data will help drive our decision making. So yes, we're prepared because we check our data every day and look for trends and opportunities to try to contain any outbreaks that we're seeing. And so yes, I think we're prepared from a health department perspective to be responsive to those needs.
Well, thank you again. Let me reiterate a couple things we've talked about that are very important. One is the census. We want to make sure, because a lot of the resources that we get, that Dr. Bogan and her team and we have at Human Services and other things that were brought up before, require the formulaic, the funds that we would get from the federal government based on everybody being counted, and we want to make sure everybody's doing that. And we have the number up to 65% now participation, which is great. We want to continue to move that forward. Also, and I've reminded a number of people over the last couple of weeks, democracy, participating in the election. 20 days from now, we have election day, but as of now, just about most people would have seen an absentee ballot application, a mail-in ballot application that you would have gotten. We certainly want to encourage, again, we talk about working by home, you can vote at home. This is one more thing that we can keep people from coming in contact and potentially spreading the virus. So all of these activities that we all go through our daily lives, this is one in which our county election department, I know they're working very diligently. I think there's been 175,000 folks that have already requested their mail-in ballots, which is much, much higher than we've ever had, but we want to continue to get everybody who wants to participate in the democratic process and do it safely. And do their mail-in ballot. So I want to thank Dr. Bogan and the team that continues to work every day to do their best and to keep us safe, and all the folks out there being responsible, being cooperative, working together. And I couldn't be more proud of the region that I grew up in and continue to work in. And we just got more to do. We've come a long way to get into yellow. Very, very proud of the fact that we've been able to do that, and we can open up part of our economy now. But once we do that, we've got to continue to be responsible, continue to be vigilant. We're responsible for each other, for our neighbors, for our family, and our community. Let's continue to do so and stay healthy.